With rigorous new systems in place, our hospitals and care centers are ready for your safe arrival and treatment. Patients and employees are always masked. Lobbies and high-touch surfaces are cleaned and disinfected frequently. Waiting areas have been reconfigured for appropriate distancing. All COVID-19 patients are kept in separate and strictly isolated areas, and visitors, with rare exception, are restricted. Banner Urgent Care and Banner Imaging have specific locations where patients with no fever or respiratory symptoms can receive care. And anyone scheduled for surgery is first tested for COVID-19. Whether you need to see your doctor, have an elective surgery, or receive any other routine or urgent health service, we want you to rest assured that we've taken every step possible to protect you and those you love.
Good afternoon. This is David Lozano with Public Relations at Banner Health. I want to thank members of the media for joining us today. I will be moderating today's virtual press conference where we'll be sharing updated information with you about COVID-19 at Banner Health. Now, before I introduce today's speaker, I'd like to provide you with a few tips for how to successfully navigate this virtual platform. This press conference is live and it is being recorded. If you have a question during the press conference, type it into the Q&A box on the right of your screen. If you don't see the chat box, click on the question mark icon in the navigation bar. Please include your name and media outlet affiliation with your question. And please remember to type your question as if you're asking it in person. Any questions that come in after the press conference concludes will not be answered on camera. We will follow up with you separately. Please note that questions that contain protected health information will not be published. A member of our team will follow up with you directly and privately regarding your inquiry. After our speaker is done with her media update, I will read your questions out loud so that she can answer them for everyone in attendance. And after our press conference concludes, we will provide you with the high-resolution recording that we'll post to our newsroom. This will include a transcript and any supporting materials that were referenced or shared during the press conference. You'll find those things at bannerhealth.com/newsroom. I would now like to introduce you to today's speaker, Dr. Marjorie Bessel, Chief Clinical Officer at Banner Health. Correct spelling of her name is M as in Mary, A-R-J-O-R-I-E, B as in boy, E, S as in Sam, S as in Sam, E-L. Dr. Bessel, I will now turn this over to you.
Thank you, and thanks for joining here today. In the week since my last press briefing, we have continued to see an increase in COVID emergency room visits, hospitalizations, ICU admissions, and ventilator usage. In addition to an increase in COVID ICU admissions here in the state of Arizona, the number of non-COVID patients in our ICUs is also high for a summer month. Currently, we have 435 patients in our ICUs. To put that into perspective, we had 484 last year at the peak of the summer COVID surge. Last week, I shared with you that pediatric patients make up 5% of our total COVID hospital admissions. I wanted to elaborate on this statistic because there were some follow-up questions related to this item. In the month of July, we had 71 COVID-positive pediatric patients admitted to Banner hospitals, which is double what we saw in the month of June. ICU admissions and ventilator usage are low for this age group, and most our COVID-positive pediatric patients only require progressive care rather than needing to be in our intensive care units. This does not mean that the virus cannot have a serious impact on children. We are seeing it already in other states like Louisiana, Florida, and Texas, where pediatric volumes have sharply risen due to COVID and an unseasonable spike in respiratory illnesses amongst children. Unlike what Banner has experienced thus far this summer, hospitals in other major metropolitan cities across the country have seen COVID pediatric ICU admissions and ventilator usage increase dramatically this past month. Now, I know that many of you are concerned about kids going back to school. I want to stress that there are several steps that we can all take to keep kids safe in school. First, get vaccinated, and vaccinate your children if they are age eligible, which is 12 years of age or older for vaccine. The more of us who get vaccinated, the more we protect those who are too young to get vaccinated. If your child will participate in in-person learning this year, have them mask up in school. And finally, do not send your children to school if they are sick. As with prior COVID surges, staffing will continue to be a top priority as we prepare for an increase in COVID hospitalizations, as well as other seasonal illnesses like the flu, which will likely be much more of a factor this year due to the easing of mitigation measures like masking. Those mitigation measures helped to suppress influenza last year. In addition to jobs that we have posted for our core staff, we are also hiring travel nurses to begin assignments this fall. Before I open for questions, I would like to ask those of you in the community who have not yet been vaccinated for COVID to do so as soon as possible. You can make a profound impact this surge by getting vaccinated. By doing so, you will protect yourself as well as those who are around you from serious illness and death. Please also continue to mask when you are indoors and around others who you do not live with. I ask you to do this regardless of your vaccination status, as we have learned in recent weeks that the Delta variant is highly transmissible. And lastly, please get tested and isolate if you have symptoms that are suggestive of COVID infection. This includes even mild cold-like symptoms. Thank you.
Thank you, Dr. Bessel. At this time, I will read questions submitted by the reporters in attendance so that Dr. Bessel can answer them. Our first question comes from Howard Fisher, who is a reporter with Capital Media Services here in Arizona. Do you believe that schools should mandate masks of faculty and staff?
So I'm going to go back to my comments that I stated in the beginning, which there are 3 things that we can all do to help keep our kids safe and in school. Number 1, everybody get vaccinated who is age eligible. Number 2, mask up when in school. And number 3, do not go to school when you're ill. All of those we can help with, and I look forward to all of us doing that so that the kids can be in school and also be safe.
Megan McNeil from KOLD TV 13 in Tucson asks 2 questions that go together. I'm going to ask you the first question, Dr. Bessel. Megan says, thank you for the June-July pediatric numbers. How many children are hospitalized with COVID-19 among your Arizona hospitals currently?
Let me, just give me 1 second here to refer to some of my data. We may need to follow up with that after. What I do have for today is number of pediatric patients who are hospitalized in enhanced precaution, which are those that may have COVID or undergoing testing for COVID. That number today is 50.
And then the second part of that question, how many are in the ICU and are on ventilators?
I do not believe that I have those numbers with me. We can follow up and get that information to you after the press conference. Thank you.
Next question again comes from Howard Fisher with Capital Media Services here in Arizona. Do you believe there will be limits on elective surgeries because of COVID and other respiratory patients?
So it is our desire to, here at Banner Health, be able to take care of all of you who are in our communities that need us. At this time, we are managing, taking care of those who have COVID as well as those who have non-COVID. We would like to continue to do that for as long as possible and hopefully throughout this surge. There are things that all of you can do out there to make sure that we, as a healthcare delivery system here in the state of Arizona, can be available to everybody who might need us. Please, if you're not vaccinated, do so, and remember to mask when you're indoors. That will help us as a healthcare delivery system preserve our ability to be there for everybody who needs us, both COVID and non-COVID patients.
Megan McNeil with KOLD TV 13 in Tucson asks, do you have concerns with the number of children being on ventilators? Why?
So at this time, as I stated in my opening comments, Banner Health's experience is that most of our pediatric patients who are in enhanced precautions or testing positive for COVID are actually not in our ICUs. So other parts of the country and other states that I referenced are having a different experience. We will, of course, continue to monitor that, and we'll bring statistics to you in our briefings as they do emerge. But right now, most of our pediatric patients are requiring med-surg type of care.
Liliana Salgado, who is a reporter here with the one of the Spanish-speaking television stations in Phoenix, asks, how many of the 435 patients in the ICU are COVID-19 patients?
Give me 1 second to refer here to see if I have that statistic readily available. Hold on. So right now in our ICUs, 90 patients are COVID and 345 are non-COVID.
Nicole Garcia with Fox 10 News here in Phoenix asks, in the last few weeks, the COVID death rate in Arizona has spiked. Is Banner still using refrigerated trucks as temporary morgues?
At this time, we have not had to expand our morgue capacity.
Megan McNeil with KOLD TV, Channel 13 in Tucson. Do you have a response to protests against the vaccine mandate for Banner employees?
So we, as you know, here at Banner Health, take the safety of both our team members and our patients very seriously. And it was after significant deliberation that we decided to make the COVID-19 vaccine mandatory to, again, make sure that we create the safest work environment as well as the safest place that we can for delivery of care. It was with that thought that we put that into place, and we continue to stand by that rationale and look forward to being a safe place for care as well as a safe place for our team members to work.
Elisa Resnick with Arizona Public Media asks, how does the surge of cases and hospitalizations compare with Pima County's high numbers this January?
I'll have to go back and do some cross-referencing of that for that specific county. Again, I'm going to go back to my opening comments where I shared that, again, broadly at the Arizona state level, we have 435 patients in our ICUs. And putting that into perspective, we had 484 last year at the peak of the summer surge. We'll go and get some additional detail around Pima County to share with you.
Katie Davis-Young with KJazz Radio here in Phoenix asks, can you elaborate on the percentage of COVID-19 patients who are vaccinated or unvaccinated?
I do not have specific information that I can share with you today. We are still working on being able to provide very detailed information and accurate information on that. What I will say is that it continues to be our understanding and our preliminary data showing us that the across the entire country of individuals who are having COVID and being in our hospital or having COVID and being in our ICUs continue to be the unvaccinated. So again, I would urge all of you that are out there who have not yet had time or gone to get your vaccine to please go and do that. The Delta variant is very transmissible, and the vaccine will protect you from hospitalization and from death.
Cameron with ABC 15 asks, what type of planning are you doing in case we do experience a potential surge as far as staffing, rules, and procedures, etc.?
So I'm going to refer to a couple of additional notes here with some details in regards to that. So first of all, I want to assure all of you that Banner Health has continued to be in planning mode, even as we had a lull of COVID-19 cases over the preceding months. So as far as our policies and our procedures and our responses, we continue to evaluate on a day-by-day basis, and we'll continue to implement those types of activities that worked for us in the past. We've already communicated, as an example, changes of our gating criteria as it relates to visitors. In addition to that, as I shared in my opening comments, Staffing will continue to be a prime concern for us and one of our activities that we are spending a lot of time on. Right now, we are doing a number of different things, and I'll provide this to all of you that are listening. We currently have a number of openings for nurses and other support role vacancies. If you're interested in applying, you can go ahead to bannerhealth.com/careers. In addition to that, we've done some wage adjustments, and that is to both attract and retain workers, and we've raised our minimum wage to $15 per hour system-wide, and we are also investing in nursing. There has been a very large demand across the country related to nursing demand, and we have put efforts into place to keep them well with on-site counseling, comprehensive well-being offerings, and also raised significantly the starting pay rate for many RNs so that we can stay competitive in the marketplace. We are ramping up for fall staffing and are bringing in approximately 1,500 travel nurses.
Aaron O'Toole with KUNC in Colorado asks, do you have data available for cases, hospitalizations, and ICU utilization for Banner Health locations in Colorado?
We do. I do not have those statistics broken down with me here this morning, but we will go ahead and follow up. We do have those numbers for you, and we'll be happy to share them.
Peter Samore with KTR News asks, should the governor and state legislature reverse course and mandate masks in schools? And Peter is with KTR here in Phoenix.
So I'm going to go back to my opening comments and say that there are 3 things that all of us can do to help make sure that kids are safe in school. Number 1, get vaccinated. If you're age eligible to get vaccinated, do your part and get vaccinated so we can help protect those that are too young and age ineligible at this time. Number 2, as has been suggested by the CDC and other pediatric societies, children should mask in school. And number 3, very importantly, because the Delta variant is so transmissible, kids should not go to school when they're having any symptoms.
Stephanie Innes from the Arizona Republic asks 2 questions. So I'll read the first question off to you, Dr. Bessel. You said 71 COVID positive pediatric patients were admitted to Banner hospitals in July, and that was double the number admitted in June. Is that correct?
That is correct.
Second question, is that number more or fewer than the number of COVID positive pediatric patients hospitalized in Banner hospitals during previous COVID surges in Arizona?
I will have to get back on that one too. I do not have that exact number with me here, but we will get that in follow-up.
Nicole Garcia with Fox 10 News here in Phoenix asks about our nursing shortage. There is a concern of a nursing shortage. Has Banner experienced a loss of nursing staff because of burnout and or resignations?
So the short answer to that is yes. As most all healthcare systems across the country have experienced, Banner Health is experiencing turnover in our nursing staff. I want to do a call out to all of those nurses and other care providers that are in the front lines. They have done tremendous work, and nurses have done tremendous work throughout this pandemic. As I articulated in one of my prior answers, Banner Health is responding with a number of different activities to both retain as well as attract the nurses that we need to be able to be here and provide care to all of you that are in our communities. I'll re-articulate several of those that I answered in my previous response. First of all, we have raised minimum wage for those that are in support roles to $15 per hour system-wide. Number 2, we have openings posted. If you're interested, bannerhealth.com/careers is where you can go and apply. Next, we are offering a number of activities for wellness and counseling to help make sure that our nurses are doing well, that are out there doing tremendous work. And also we have increased our pay rate for starting RNs across our organization and making sure that we're staying competitive in the market. And lastly, we are ramping up for fall and are bringing in approximately 1,500 travel nurses to help supplement the staffing that we know that we're going to need.
Benito Kelty with the Tucson Sentinel asks, could you please follow up with the number of pediatric cases in the ICU and on ventilators?
We will go look at those numbers and follow up.
Elisa Resnick with the Arizona Public Media asks two questions. So I will ask you the first question, Dr. Bessel. How many people who are hospitalized in ICU or other currently are vaccinated?
I'm going to repeat the answer that I stated previously, which is that we're still working on getting accurate data for that. But our experience so far appears to be very similar to what the experience is across the country. The vast majority of individuals who are being hospitalized or requiring ICU care are amongst the unvaccinated. We continue to experience that here at Banner Health, and when we have highly accurate data that we're confident about, we will absolutely share it.
You might have already answered this question, but I will ask it again. With this current highly infectious variant, are you seeing more serious cases among those who are already vaccinated? And that's the second question asked by Elisa Resnick with Arizona Public Media.
So we are not. So again, our experience so far is very similar to what's being reported across the country, that for those individuals that are vaccinated and are having breakthrough infections, they are having a much milder illness than those that are unvaccinated and becoming infected with the Delta variant. Again, the vaccines were made to protect you from death and serious illness, and they are doing an excellent job of that. Those that are vaccinated may still experience a breakthrough infection with Delta, but that infection and those symptoms are going to be much milder than if you were unvaccinated.
Nicole Garcia with Fox 10 News here in Phoenix asks, are you anticipating some Banner employees may resign or be fired for not being vaccinated after the deadline?
So our intent is to make sure that our work environment and our care delivery for patients that need us is as safe as possible. And as I answered on a previous question, that has been the rationale for the mandatory vaccination. It is also our intent for all of our team members currently employed by Banner to stay with Banner. We are working with individuals to explain to them our rationale and to encourage them, if they are not yet vaccinated, to get vaccinated. It is our absolute desire as we get to our November 1st deadline to have every single team member continue this journey with us as we make ourselves a safe place for care and make ourselves available to all of you who may need our care, whether it's for COVID or non-COVID reasons.
Mark Phillips with ABC 15 here in Phoenix asks, is Banner considering suspending some or all of its elective surgeries?
So our desire is to make sure that we're serving the community, and that includes COVID patients as well as non-COVID patients. At this time, we are not suspending any elective surgeries, and it is our desire to hopefully not have to do that again. We know that those of you that are out there that need a surgery are counting on us to make sure that we can get the surgery that you need. We will continue to update you as this surge continues to unfold. And if we change a direction or have to make a different decision, we will certainly communicate that to everyone, our surgeons, our patients, our staff, and those families.
Liliana Salgado with Universidad Arizona here in Phoenix asks, you mentioned that last year during the surge, you reached 484 ICU patients. You just clarified that 90 of the current 435 ICU patients were COVID. Do you know how many were COVID patients during the peak you mentioned?
I don't, but the percentage was much higher. We can go ahead and get that exact statistic for you.
Nicole Garcia with Fox 10 News here in Phoenix asks, does it appear that COVID patients in the hospital right now have more severe symptoms during this surge versus previous surges?
I can't really answer that question at the level of detail that I think the question is asking for. What I will say is that these patients who are, again, the vast majority are unvaccinated that are in our ICUs are still very, very ill. Many of them are requiring ventilator support. Some of them are also requiring ECMO support. So again, my message to all of you that are listening out there is if you are unvaccinated, please go get vaccinated. Protect yourself from death and hospitalization with this very, very transmissible Delta variant.
Benito Kelty from Tucson Sentinel asks, how close is Banner Health to getting all its employees vaccinated since it required all employees to be vaccinated?
So we still have a ways to go. I will bring those statistics forward in future press conferences, but we still have a large number of individuals that are either in the process of getting vaccinated or submitting their vaccine card to us. Again, as we've communicated out there, our deadline for that is November 1st.
Howard Fisher with Capital Media Services here in Arizona asks, why are you avoiding taking a position on mandatory masks in schools when you say children should be masked?
So my position is that children leave to others. CDC guidelines as well as support from other pediatric.
From first, what has been Terry Tang with the Associated Press in Arizona, can you quantify the staffing or nursing shortage at Banner? What is the ideal number of permanent and contract staff Banner would like to have, and about how many do you currently have?
So I'll answer that in the best way that I can with statistics that I have available to me today. So just as a reminder to all of us, Banner always brings in external contracted labor or travel nurses every winter season. We experience a surge due to respiratory pathogens like influenza, and we always augment our staff during those difficult winter months. So this planning is not different from prior years, but the magnitude of what we're likely going to need due to the COVID surge, of course, is significant and concerning at this time. To put a couple of numbers into perspective, we currently have, and this was shared with media, I believe, yesterday, the following nursing shortage numbers. We have 1,057 bedside RN vacancies and 327 nursing support role vacancies. Obviously, in an ideal world, those numbers would be much smaller, but we will continue to hire and ask anybody who's interested, again, to go to bannerhealth.com/careers, and we will continue to supplement with external contract labor as needed.
Nicole Garcia with Fox 10 News here in Phoenix asks, the Arizona Department of Health Services website indicates under 200 ICU beds are currently available statewide. How many ICU beds are open at Banner hospitals, and what is the current capacity of ICU beds?
I do not have those numbers with me. We will follow up with you afterwards. Banner Health does participate in submitting to Arizona Department of Health Services as required those numbers, and we can go ahead and grab those for you and get those to you after the press conference. Thank you.
Elisa Resnick with Arizona Public Media asks two questions. I'll ask the first. What is the average amount of time people are spending in the ICU in Arizona?
So the average amount of time that COVID patients are spending in the ICU in Arizona continues to be approximately the same as last surge. Most of those patients spend more than a week with us in the intensive care unit and also have a multi-week total hospitalization. So for individuals who get COVID that require that level of care, they will be in our hospitals for quite a bit of time as they both receive intensive care as well as then recover before they're able to go and be discharged from our hospitals. Again, in order to avoid that, I ask everybody out there who's not yet vaccinated, please get yourself vaccinated to avoid being infected with this highly transmissible Delta variant and avoid coming into our hospitals with this terrible COVID-19 disease.
And the second part of that question from Elisa Resnick with Arizona Public Media, is there a concern of capacity issues at this time?
So at this time, we are operating without capacity constraints, but I will say that with the surge that we're beginning to experience and we've been reporting out here through the media, we are concerned if that trajectory continues. We're asking all of you to help with us. We are doing our part. We've talked about the number of nurses that we're bringing in as an example for traveling nurse supplementation to our staffing, but we need your help. If you're unvaccinated, please get yourself vaccinated. This Delta variant is highly transmissible, and vaccines remain especially effective at preventing death as well as serious illness requiring hospitalization.
Liliana Salgado with Univision here in Phoenix asks, Valley Wise Hospital announced last week that they had to open a second COVID unit, as Banner needed to open more spaces that were already unused for COVID.
We have had to dedicate some of our space for COVID only. This is something that we did in prior surges. It's also something that we do to make sure that we're cohorting these individuals who have a highly contagious disease. So we do have COVID units already open, and we'll continue to open more of those as the COVID surge continues to make sure that we're meeting the needs of our community.
All right, Dr. Bessel, and that looks like that was our last question, so thank you very much. We have reached the end of our press conference. Thank you all for joining us this afternoon. As a reminder, a high-resolution video, transcript, and any materials shared with you during this press conference will be available at bannerhealth.com/newsroom. Please allow 2 hours for us to post all these materials. And please send any follow-up questions that you have to media@bannerhealth.com. Thank you. Thank you.